Language Advocacy Day Canada, February 4th, 2021. #LAD21. Thank you to our coalition partners for making Language Advocacy Day possible.
Our next conference panel is about pandemic communication and language gaps. Immigrant and refugee-serving organizations, as well as other organizations working with immigrants, are often system navigators and points of reference for newcomers and local communities. During the pandemic and the shift to remote and digital work, this role had two important sides. One was helping newcomers understand the support available to them from the government and understanding how they could access support from agencies. The second was providing useful, authoritative, up-to-date, and relevant information about COVID itself and how to deal with the pandemic. The second has been and still remains a significant challenge. Misinformation and disinformation has flowed at unprecedented rates during the pandemic. Community organizations, healthcare providers, and communities themselves have struggled with both a lack of formal system support from government as well as a changing information landscape. This panel will focus on promising practices and lessons learned during the past year, including gaps and unaddressed issues, as well as the creation and distribution of effective multilingual information. Our moderator, Marco Campana, has over 28 years of experience working in the newcomer serving sector with communications and digital services, from frontline client service to being the very first settlement.org content coordinator. He created and managed the Settlement at Work site, launched Advocacy's Learn at Work online learning site for sector workers, and has participated in a number of efforts to enhance sector knowledge mobilization. He led digital and social media strategy work at Maytree, and most recently, he has been working as a freelance digital strategist, helping agencies to harness technology and improve client service delivery. Marco's current focus is on digital transformation and demystifying technology and social services, immigration and diversity, and inclusion in Toronto. He believes technology is a means to an end. Welcome, Marco, and please introduce us to your panelists.
Hi, everybody. Thanks so much for having us. Today, we are very lucky to be joined by three panelists doing interesting work in this area, and I'm quite looking forward to hearing from all of them. So I'll start with George Abraham. George is a founder, publisher, and executive director of New Canadian Media, who brings 30 years of writing and newsroom management experience. He began his journalism career with the Times of India in Mumbai, followed by stints at the Khaleej Times in Dubai, and as managing editor of The Peninsula in Qatar. A journalist with high ethical standards, George won the prestigious Nieman Scholarship at Harvard University in 1994-95, and more recently pursued a master's in journalism at Carleton University. Welcome, George. Louisa Taylor is a communications professional and nonprofit leader who thrives on bringing diverse people together to spark connection, strategic thinking, and innovation for social change. At Refugee 613, she leads a small dynamic team and an extensive network of partners working toward a welcoming world where everyone can thrive by convening and strategic communications to build stronger communities. Welcome, Louisa. And Sukhmeet Sachal is the University of British Columbia medical student and co-founder of the COVID-19 Sikh Gurdwara Initiative, which provides a frontline community-led effort to ensure people have authoritative COVID-19 information. Since starting the project this past summer, Sukhmeet and a network of more than 100 volunteers have taken a number of steps to ensure public health measures are introduced to people attending the Gurdwara with cultural awareness in mind. So we have a number of questions that we're going to work through, and we certainly welcome questions and comments and insights from the audience as well. Thank you, Louisa, George, and Sukhmeet for joining us. So I want to start with our initial question is, when it comes to providing accurate, timely, multilingual, culturally relevant information about COVID-19 in Canada, what's the problem? And what are you doing to address that problem? Louisa, you're on my left, so why don't we jump in with you first?
Thanks, Marco, and thank you, everybody, for inviting me to join you today. I think this is an amazing event and a very, very important topic. So what is the challenge in creating access to timely, accurate, relevant, translated material? The first challenge that I see in the work that we do at Refugee 613, where we're focused on information and access to information and information flow, is that the sources of information, especially related to COVID right now, are not applying an equity lens to their communication strategies. So instead, they are following general Comm's best practices as far as they understand them, without recognizing that newcomers often have very specific needs as an audience and practices. And what that means is not just in terms of language, that's hugely important, but in distribution channels, in the type of content. Often straight translation isn't enough. It needs to be culturally relevant translations. And those things are not embedded in the content creation themselves at the institutional and source level. So that's the first thing I would say. The second thing I would say is that an understanding of the importance of access being addressed on multiple levels does not exist very much in the sector, in the settlement sector, and in the government sector and public health. So what I mean by that is there's no magic bullet. There's no one fact sheet. There's no one door knocking campaign. There's no one social media campaign that is going to address everybody's information needs. We need to be very active on multiple fronts at the same time. And we need to invest. So that's the third thing I will say. Communication is expensive. We tend to think that because we all communicate all the time, that we're all good communicators. We know that's not the case. And also that, you know, I'm talking now, it's not costing me anything to speak, yet there is a tremendous amount of work that needs to go into making sure that that equity lens is applied and that communication happens in a way that makes sense for an audience. So you need somebody who is connected to the audience and understanding what their practices are and how they can best receive the information they need. You need someone who's good at writing or content creation, whether it's creating video, audio, or some other format. You need people who can do design. You need people who understand workflow, moving the content through all those pieces. And you need somebody who understands distribution, all the different channels that something can be shared on, as I just mentioned, in person, digital, etc. And then measuring all of that. All of that, to do it successfully, there's no question, takes the investment of time and resources. And that's not adequately represented yet when it comes to newcomer audiences. There's lots more I can say. I'm just going to pause there because I know that the other folks on the panels will have great things to contribute as well.
So Kmeet, I want to jump to you because I think you embody the practical application of some of what Louisa is talking about in a specific community. So maybe you can speak a little bit to some of that.
Absolutely. I was just nodding my head and smiling widely while Louisa was speaking because I 100% agree with that. Well, first of all, thank you for inviting me on this panel as well. I'm a second-year medical student at UBC. And even before being a medical student, I was actually a public health professional. I did my Master of Public Health degree from Western University. And that's where I really realized and understood what public health is all about. And when I saw the government of BC, I'm currently in British Columbia. And so I saw that the government was doing a wonderful job in terms of communicating every single day on TV in English, as well as sometimes in French as well. But British Columbia, I'm sure Ontario as well, and many places across the country have a huge South Asian population. And as an immigrant myself, I was one day actually at the Gurdwara where I saw that people were not wearing a mask. And I didn't know why they were not wearing it because there were, announcements every single day about wearing masks, following these public health protocols. And then it was just me and my dad who were wearing a mask. And then I started asking people at the Gurdwara, which is the Sikh house of worship. And I asked them, I'm like, why are you not wearing a mask? They're like, well, first of all, these masks are not even accessible to us. As you can see, my turban, my ears are covered. And so the regular mask can't even fit my turban. And then I asked them, do you know all the other different public health protocols? And the elders over there were like, we don't understand them. And so that's when I knew I had to do something about it. And as Louisa said, I think communication is so important. The government, I mean, everyone's trying their best. COVID was a very new thing that happened in this world and no one really knew how to react to it. But I think a lot of the times in public health, we really just group everyone in together, which I mean is nice to bring everyone together. But at the same time, I think we need to have the health equity lens to it. There are so many people in Canada. Canada is the most multicultural country in the world, where we have so many diverse people from different countries. We speak different languages and we really need to cater to them. I think when people talk about COVID, in the beginning, everyone might have said that, you know, we're all in the same storm, but actually we're not really in the same storm. We might, the COVID might be the thing, but we're all in different boats, and all these different boats have different holes in them. These boats have different needs, and these boats are essentially the different populations that need to be catered to. And I think I can't really expand a lot on what Louisa said because she hit it bang on, but I look forward to what George has to say about this as well.
Thanks, Sukhmeet. George, in some ways you have kind of the 1,000-mile high view, speaking on behalf of ethnic media. You know, when we're looking at the same question of what's the challenge in that community in terms of getting this information out and ensuring that these different boats, as Sukhmeet so eloquently put it, have the right information to help patch the holes that they might have.
Thank you, Marco. I want to pick up on the metaphor that Sukhmeet just used about different boats. Some of us are on cruise liners, some of us are flying the skies, but some of us have leaking boats. And one of the things that has been evident through this pandemic is that there is a lot of inequity. The pandemic is clearly affecting what we call marginalized communities to a greater extent than everybody else, and that there are language barriers, that we are a multicultural country, but our communication is predominantly geared to one particular segment of the population. And so we at New Canadian Media exist to represent what we loosely call the immigrant point of view in Canadian journalism. That is driven by the fact that 1 in 5 Canadians is like me, foreign born. And so we bring a slightly different perspective to Canadian current affairs. And for the purposes of this panel, I want to primarily speak about a project that we just completed a few weeks ago on what we called bridging the mainstream ethnic digital divide in COVID-19 literacy. So we looked at how is the pandemic being reported by mainstream media, primarily the Toronto Star and the National Post or the Post media chain, and how is it being reported in the ethnic press. And we did a series of 5 articles, and I'd welcome you to take a look at these articles that are available on newcanadianmedia.ca. And we did this in partnership with a media monitoring firm called Mirems. And I think their editor-in-chief, Silke Reichert, is on this webinar as well. So I want to thank them for their cooperation. So we looked at 5 themes. One is we looked at vaccine hesitancy. What is driving vaccine hesitancy? We looked at how the pandemic was affecting racial and ethnic minorities. We looked at the effect on immigrant labor and international students. We looked at the economic fallout of the pandemic, and we looked at mental illness, which of course is something very topical today. And we also used 10 different journalists of immigrant backgrounds, ranging from Russian to Haitian to Filipino to Indian, Pakistani. So we covered not just ethnicities, but languages. And I think what was clear to me was that all of us come at information from different points of view. Some of us, like me, I was born in a democracy, so I tend to give a fair amount of credibility to whatever the government puts out. But if you read the articles on our website, you will see some communities are predisposed to being not just skeptical, but disbelieving, and ranging as far as calling everything propaganda. So I think being sensitive to the information needs of our various multicultural communities is the starting point for any conversation around this particular topic about how the pandemic is affecting Canadians. I hope that's helpful, Marco, and back to you.
Absolutely. Thank you, George. And I want to continue along the conversation with ethnic media because, as you said, you've done some looking into what's happening in there. And in one of the articles, we're hearing, for example, in a recent Toronto Star article, the ethnic media press is talking about, around vaccine hesitancy. They need to be used as a tool to help get the word out. And in a December article on New Canadian Media, the MIRAM's president, Andres Malchelski, wrote about the role, but also the access that ethnic media has to the support. So he talked about how there is a fund that's been created by the federal government, and he estimated about 75 million theoretically could be earmarked for community and ethnic media support. However, the media outlets themselves are reporting that getting access to that money is full of bureaucratic hurdles. And then several months after the announcement, which was last May, they did an analysis looking at the different ethnic media to see what has happened with the advertisements from provinces, from cities, from the federal government, and they've seen very little that's happening there. So what without that kind of support, how can the ethnic media be an important voice in this perspective if they don't have access to those kinds of resources from government itself, and government isn't using ethnic media as a vehicle to get information out to these groups?
Is that to me, Marco?
Yeah, George, please.
Please. This is my personal opinion. Andres, I think, is a gift to Canada. This gentleman, he comes from Argentina. He's followed ethnic media for 30 years now. So you and I probably discover this disconnect between these two broad silos today, but he's been following this for 30 years. And thank you for alluding to the comment you wrote for us on March the 31st. I think I'd again encourage your participants to go and read it. It was called The Role of Ethnic Media in the War Against the Pandemic. And I don't think it's my place to suggest a solution. I mean, funding is the purview of other people. But I think the larger point I'd like to make is that we have to find ways to address the inequity. That this country is changing before our eyes, that we are still stuck in a time when probably English and French and the multitude of indigenous languages were the predominant languages in Canada. Any demographer would tell you, like I think one of your previous speakers pointed out, Urdu, Hindi, Punjabi, Tagalog, these are all languages followed by a very large number of Canadians. And so recognizing that any mode of communication will need to cover the wide diversity within the Canadian population is fundamental. And if we ever needed a wake-up call, I think the pandemic is surely a spur that should foster a conversation around how does not just the government, but NGOs, organizations like the work that Louisa is doing, and it is a wake-up call.
Thank you, George. Louisa, on that note about the broader community coordination, can you tell us a bit more about your efforts at Refugee 613, including what you're finding and learning around the experience of providing information and referral with newcomers through digital messaging, as well as the Newcomer Info Hub project that, that you've recently been working on?
Sure. I think that the biggest learning for us once the pandemic started was the true depth of the gap, or the true size of the gap between the need for information and the supply. And we really hadn't fully absorbed that. We thought it was really focused more on settlement information for newcomers. And settlement and other frontline services do so much information provision, and even then that's not enough. But what the pandemic showed us was there was this just ginormous gap when it comes to accessing health information, or information about CERB, any kind of government program that was related to the pandemic. And so we saw some relevance for the work we've been doing on exploring how we can best use some of the more cost-effective, easy to apply tools like digital messaging. So the use of WhatsApp, WeChat, Telegram to reach newcomers, because so many newcomers are already there. It's second nature to them to be WhatsApping with family and friends in Canada and back home. And so why not tap into that information practice of theirs? And yet as a sector, we've been fairly slow to take advantage of that. So we've had a project that Marco has been part of for a couple of years now called the Digital Messaging for Settlement and Integration Project. We culminated in a summit a couple of weeks ago where we shared our toolkit on how to use digital messaging to both sort of broadcast information widely to groups, but also in one-on-one services. And it's not overly complicated, but there are some really important key steps to put in place before you begin, so that you can create a safe space and an efficient and effective space. So we kind of stepped up our advice to partners around how to use those tools, and that's been a big feature of the pandemic for us. And then looking at trying to close some of those gaps in the provision of information. Right at the beginning, we were seeing a need. Our partners on the ground in settlement were creating their own fact sheets and translating them, and of course that's not what they're being paid to do, and they're already pivoting to provide virtual service. And so everyone was scrambling. And that led us to see a need for two things: more culturally sensitive translated information that was useful and didn't just meet the needs of what public health officials want people to know, but answered the questions of what newcomers want to know, which often could be quite different. And so we saw the need for that content creation, but also to connect people who are trying to find this information, because there is no one single database in the country that holds everything that everybody needs. So with IRCC funding, we launched the Newcomer Information Hub last fall, or late last fall. It's has two components: a Facebook group that you can. It's a private Facebook group, but you just ask to join, and we let you in. And it's a place to go in and talk to others. Say, I need a fact sheet, in this specific language on this topic. Does anybody know if it exists? We also have a database attached to the Facebook page that you can search to find resources. You can also, if you're not on Facebook, you can get in touch with us, and I'm going to post information on this in the chat about to access the database yourself. But the real goal for us with the Information Hub, and the other piece of the Information Hub is we have a content team that is looking for and listening to members of the community to find out what they need, and then we're generating the content. So this has led to partnerships with others who are just trying to do the same thing. We've created a vaccine bulletin in multiple languages that's just started to go out to address vaccine hesitancy, and it's going to be a series. We've done infographics on provincial shutdown measures, and specifically in Ontario, but we're open to helping other provinces with theirs because it's a national project. And the other piece that we found is just that collaboration piece, connecting people who are trying to work on this together, because we know that someone in Saskatchewan may have developed a fantastic resource that someone in Newfoundland might want to use. And so we want to be able to create that space and bring people together.
Thanks, Louisa. Sukhmeet, and some of what I've read about your initiative, one of the things that struck me that you said was you realized when people see themselves, they're more inclined to follow through. And again, you're sort of the embodiment of some of what George and Louisa have been talking about on the ground. So I'm wondering if you can tell us a bit about really practically how the experience of making sure that your community sees itself in public health messaging efforts and what the outcome of that can actually be.
Absolutely. I think at the end of the day, when you see someone that looks like you and is doing something that, following the public health protocols, you're more prone and you're more likely to actually follow through with it. I think that's even just psychology, like basic psychology, where if you see someone do something, you're more inclined to do it, and the people that you surround yourself with. So again, back to my project, I think Louisa and George really, it's funny because everything that they're saying is everything that I've implemented. So I think it's just great to hear that. So what we did is when we were in the Gurdwara, we noticed that people could not wear a mask because again the ears were covered, and so we helped devise a mask that can tie around a turban, so that we provided this to every single person that came inside the Gurdwara. And not only that, but we created these infographics with people. Instead of just stick figures, we had a person with a turban on it, or a person with a headscarf on it, so that it can relate to the people more. And we noticed that once we were not only just giving them these masks, but we were educating them on why you should be wearing a mask and how it can help spread or stop the spread of COVID as well. The second thing that we did was about hand hygiene. And that was, again, something that might seem easy, but actually a lot of people don't know how to wash their hands properly. And so we had people there in the Gurdwara, our volunteers or youth volunteers, who I trained along with our health authority on how to teach people how to wash their hands properly so that they can take this information and they can take it back to the community. But I think the last point, which was about physical distancing, was the most challenging to implement in the beginning, because as humans, especially South Asian, we love to hug people and we love to, be close to people. And so I think that was the toughest part for especially the elders, because they gathered at the Gurdwara as a place not only for spiritual health, but also just for their mental health and to meet their friends. It was basically like a community hub. And that's where that was the main reason why I decided to even implement the project in the Gurdwara, because a lot of times public health measures are done in an inaccessible way. And I really wanted to make it accessible and to meet people where they're at rather than them coming to us. So we're actually going to them. So the last point I was talking about was about physical distancing. And I noticed that, okay, so I started off by, creating the stickers that I saw in Tim Hortons. I was like, maybe I can adapt this to the Gurdwara, where I wrote 6 feet apart in English and in Punjabi, and I put it on the ground. And I noticed, okay, in the beginning, people were looking at it, but after a while, no one was looking over it. They were getting dirty. People were just stepping over it. And I was like, okay, clearly this isn't working. So we need to go back to the drawing board. And one day I was actually tying my turban. And when I was tying my turban, I realized it's exactly 6 feet long. Believe it or not, this turban is 6 feet long. And I was like, okay, I had a eureka moment. I'm like, okay, this can be a way to help educate the public. And so I went to the drawing board. I created an infographic where there were 2 people standing 6 feet apart and they were stretching out a turban. And that's actually how you tie a turban. You stretch it out. And that's when I realized, okay, created this infographic, asked my graphic designer to make it into a better design. We got it printed. And this was now at the Gurdwara. The first thing when you walk in, you see this big 6-foot cardboard cutout. And it was amazing. You don't even need to know Punjabi anymore. You don't need to know Hindi. You don't need to know English. You don't need to know French. You don't even need to know any languages. I know we're talking about language accessibility, but in that perspective, we didn't even need to know languages. If people just looked at the image and they saw what they were seeing, they saw someone wearing a turban, they saw people stretching out the turban, they knew exactly what 6 feet apart is now. And that was just amazing. People started to understand what it was, and people started to relate to it. And in the Gurdwara, people were finally following, this public health protocol. And I really wanted to echo on what George said as well about ethnic media. I think the first exposure we had to the media was ethnic media reaching out to us, and they really wanted to cover our story. And I think that was the beauty of it, because it really helped spread our message. Once an ethnic newspaper covered our story, CTV reached out, CBC reached out, Global reached out, Apple reached out. There were so many different, I think I did over 50 interviews in 1 week where all this media wanted to cover our project, because first of all, it was very simple. It was so simple. We just focused on 3 main things. How can we teach people how to wear a mask? How can we teach people how to wash their hands properly? And how can we teach people to follow physical distancing? But I think when the restrictions happened in British Columbia, we had to take a whole new route, because there were less people allowed in the Gurdwara. So our volunteers could not really be there, and for their safety as well, even though they were wearing, a face shield, a mask, gloves, and everything that we provided. I wanted them to be safe as well. And so we transitioned everything to online. And of course, all our infographics, everything are still in the Gurdwara, and they're still making an impact. But now what we did is we're using all the media that Louisa was talking about, WhatsApp, Facebook, Instagram, Twitter. So Twitter is one where we can reach our infographics to more of the medical professionals, public health professionals that can help spread our message. Facebook is more for the older demographic. Maybe, I'm 26, I'm maybe considered old now to the younger generation, but for people who are my age or even older who use Facebook. Instagram is more for the youth out there who can maybe use our infographics and teach this to their grandparents or to their friends. And then WhatsApp is for every single South Asian who uses WhatsApp every single morning to spread messages. And we're like, you know what? We need to combat the misinformation with positive information that is true, evidence-based. And even Louisa was just talking about how there's the vaccine hesitancy. In the South Asian community, I noticed on Facebook, people were spreading lies, and there were people who were saying, in the vaccine, there's fetal blood or there's pig blood in it. And this was all just false information that was propagating. And so we created this very, very simple and effective infographic where we showed exactly what is inside this vaccine. And we had it in English and we had it in Punjabi. And we created multiple of these different types, like how was the vaccine developed? What is inside this vaccine, and why should you take the vaccine when it is your turn? And again, people started to realize that, okay, these youth are doing positive work in the community. They're not wasting time. They're using evidence-based information with the local health authority to get this information across. And people started understanding it. People started listening to it. Our social media outreach has been even more than I ever expected it to be. We're reaching so many people, not only in British Columbia, we've spread now to Alberta, to Ontario. People from California have reached out to get these infographics so that they can use them. People in Kenya have been reaching out. And so I think role of ethnic media, mainstream media, social media has really helped, bring everything together so that our message can get out there.
It's a great segue to our follow-up question. I want to tell you, in the chat, there's lots of interest in getting your materials. So one question is, once you create something that has an impact, has the kind of outcomes that we want, and as everyone has kind of alluded to, in spite of a lack of resources, how can we ensure that that information gets replicated in a useful way and gets put out there? And I'm curious, you've mentioned you've put your resources online. I know Louisa is doing some work in that area, and obviously, George, you want to be covering these kinds of issues to provide people with the good information, the good stories, the positive and more accurate information. So, in spite of having few resources, how can you, or how have you been able to kind of encourage others to replicate what you're doing, Sukmi?
I think for us personally, we've been focusing on getting youth to get the messaging out there. I have over 150 youth now that are part of the team that, were really bored during COVID, and they were really looking for volunteer opportunities. And with everything in person basically being shut, this was a door for them to really use this opportunity to get the messaging out there. And, they can get volunteer hours for this and so forth, everything that can really help them in the future as well. And this is a huge leadership opportunity for them as well. Like, our whole organization is led by youth, and it is, I think that's the beauty of it, is to see the intergenerational impact that it's having. When the elders, for instance, were seeing youth that were doing the work, they were like, wow, okay, youth are actually caring for our community. They're coming to the Gurdwara, and now they're using their time to create these infographics, spend time translating the information, getting the information out there. And so I think for us, it's really been just the power of youth. Our Instagrams are powerful. We use Instagram for basically everything. We share it on Instagram, our stories, and that's really how it just continues to spread the message. We posted on our official Instagram page, which is Sikh Health Foundation. And then through that, as soon as we post it, we also have a Slack channel where we tell our youth volunteers, okay, we have just posted the infographic, please feel free to share it now. And we even provide just the physical copy of it as well, or the digital copy that they can then use to send to their friends, et cetera, and family members on WhatsApp, on Facebook. And that's really how our outreach has just grown. And we've noticed sometimes that people even send us pictures of our infographics in different places where, sometimes people have printed it out, they put it on a bus stop, and then they send us, they're like, oh, look, your infographic is over there. And it's something that we, again, didn't expect out of this, but it's just great when information is culturally effective and people can relate to it. And that's when, when people relate to it, I think that's when they were more likely to share it. When it's something generic, and if it's great if all the information is translated, but if that translated information means nothing, if it doesn't have the pictures associated with it that reflect the population and the demographic it's really for, no one's going to listen to it. And even our translations are so basic, which people appreciate. They're not multiple sentences. They're really just short words that describe what exactly you need to do and how you need to follow these public health protocols. And that's why people have been just, sharing it over social media.
And my sense as well is that because you're of the community and your 150 volunteers are in those spaces, in those WhatsApp groups and Facebook groups and Instagram accounts, that they're able to actually share with peers. And so one of the trends that we've been seeing is, this is going to be a question for Louisa and George as well, is that information and communication among newcomer communities is increasingly happening in private online spaces, especially things like digital messaging groups, online social networks. And so in your case, Louisa, for example, you're not necessarily embedded in the communities you're trying to get the information to. So how, and George as well, with a meta view of ethnic media, how do you ensure that good information that you might be collecting, for example, in the Newcomer Information Hub and in your resource, can actually get into these communities and sort of help combat the mis and disinformation that they may also be hearing?
That's a great question, because and right now our answer is sharing it as much as possible to as many organizations and individuals who may touch the lives of newcomers. So obviously there's newcomer networks themselves, digital or otherwise, but then there's, our focus has been on newcomer networks, settlement service providers, and health providers. But we know that, for example, community sports groups can also be distribution channels. Professional networks can be distribution channels. In our work pre-pandemic, our attitude was, or sort of our mantra internally was, the more a community understands refugee resettlement, which is what brought us to existence in the first place, the more that more people know about the refugee journey, about resettlement, about refugee needs, the better job we will do as a community to support them. And the same applies to the social determinants of health and to making sure people have access to information. So what I find is that often service providers and government especially the communicators, come to us looking for the one tactic or strategy that is going to address everybody. And our answer, and they're very disappointed in us when we tell them there is no single response. And our answer when they say, so who do we need to send this to, and what languages do we need to translate it into? We say, well, there's a decision tree here, and we have to talk about who are you trying to reach, what networks are they on, what languages. And just as a side note, I'll say that one thing we've noticed is that some folks new to this area will just look at the census and say, okay, these are the top languages other than English and French spoken in our area. Well, those might not be the people who most need translated material. That just means that numerically that group is large, but maybe a lot of them speak English or French and are fine getting their information. And maybe you need to dedicate your resources to this tiny group of 200 people who, very few of them speak English or French, and they have more barriers. So that idea that just get the information out to as many networks as possible, including sort of the unconventional, the unusual, the people you think aren't necessarily going to be your distribution channel. And I'll give you an example that we heard about in Ottawa, organized through different community groups that were responding to food insecurities during the pandemic. They started putting some public health information into the food boxes. Amazing, that's great, and that's going to reach people. However, it may not reach people who have literacy issues, so you need to find video and other ways to reach them. And the other thing is, just as no one tactic is going to solve all the information gaps, no one effort is going to. In other words, messages need to be repeated over and over. People need to hear it from their doctor, from their neighbor, on the radio, on their phone. And so that's another piece that makes it expensive, but so necessary to arm as many people as possible with the right information. Because right now, especially when we talk about vaccines, people are hearing far more misinformation in their networks than they're hearing accurate information.
Thanks, Louisa. George, did you want to take that on as well in terms of how the work that you're doing, how can you ensure that it's actually getting not just into one individual's phone or hands, but that there's a way for them to continue to disseminate it effectively to their private community networks?
Sure, I'd like to address that in at two levels. One is that based on our analysis, ethnic media has surely been part of the solution. So they have tried to be as accurate as they can be, obviously understanding that their resources are not as bountiful as mainstream media. So within their limited capability, they have been allies in the fight against the pandemic in terms of misinformation. But the larger question from my point of view is, because we do everything, we look at everything through the lens of journalism, right? Journalism as an agent of democracy, right? Our basic premise is that any democracy is only as good as the information that is fed to its people, that the information that's available to citizens of this country. And so if you were to look at the phenomenon of misinformation or disinformation, so there's the concept of a fog of lies, right? You conflate a whole set of facts devoid of context, and you make it so confusing, especially when you merge mainstream and ethnic and WhatsApp and all of that melange. You are left so confused that you can't make out what is fact and what is fiction. So we at NCM believe it's not just enough to do journalism. We have to do what we can to defend the truth, right? You continue to do factual information, but you also equip your audience with ways to assess credibility, like to become agents of change, to be discerning in and of themselves. So I'm very happy to say that NCM just last weekend held its very first interface with our readers. So we had Kathy English, who is, as you probably know, a long-serving public editor at the Toronto Star. She is now the chairperson of the Canadian Journalism Foundation, which is all about the excellence of journalism. And so we had a session for our readers entitled, "Is This a Fact?" So it offered our readers ways to assess the credibility of what they read and view and watch and listen. And I think that is the way to go in terms of addressing this whole phenomenon of lies and untruths and the slippery slope of alternate reality, as we just recently discovered during the presidency in the United States.
Thank you, George. There's an undercurrent in some of what you're saying, which you alluded to earlier, George, which is the notion of trust. Different people trust different institutions very differently. Sukhmeet, I want to address this to you because I think it builds in what George was also just talking about and what someone in the chat mentioned about the need to educate about what is a reliable source of information. How do you cross-reference? How do you look at multiple sources in your busy, busy lives when a great slogan comes in that seems so simple from someone that you trust, that could be misinformation that they're forwarding. And on the ground, building the trust and the connections that you have were clearly something that was really important and that you were able to do in your community. And I'm wondering if you can just speak a little bit to how important that has been in countering those slogans with your own slogans and imagery and messaging.
Definitely. I think it's so important to have someone who's from the same background helping to deliver and start the intervention itself. I think that's with any case. It doesn't matter if it's just a South Asian community, even with Indigenous communities, for instance, a lot of the time the research that is done is by outsiders. It's not by Indigenous peoples themselves. And so I think we need to recognize that all the time and continue to improve that in Canada and across the world. But speaking to more of the trust, I think one of the ways actually this project got a huge boost was I was one of 2 Canadians that were selected by the Clinton Foundation out of 38 youth from around the world for a COVID-19 grant. And this grant basically helped fund this intervention that we created. Without this grant, I mean, it wouldn't have been possible even to pay all of our translators and so forth to get this work done. But that really helped establish a trust because people realize, okay, these youth have, a strong foundation that is backing them up. In addition to that, we reached out to all the different stakeholders. The biggest one was Fraser Health Authority. They're the local health authority that is in Surrey. And so I reached out to them in the beginning, even before starting the intervention, and I proposed to them my idea. And they have a branch called the South Asian Health Institute. And so I reached out to the manager over there and I asked them, love to work with you. We have the youth, we have the volunteers, let's get this going. And so for a month, we actually just developed a plan. And she really helped me create a team. She's like, okay, before you even start this project, you need to make sure that you have a team so that, all the work doesn't fall on you as well. And so we created this team. They provided us with a lot of the evidence-based information that is created by physicians, by public health, professionals. And so we use this information, we helped translate it, we gave it back to them to approve, and then we published it. And then that way people were, able to know that, okay, this is all factual information that is being provided by the health authority. But I think even a bigger stakeholder in all of this was the Gurdwara itself. And so the Guru Nanak Sikh Gurdwara is the biggest Gurdwara that is in Surrey, actually in the lower mainland. And so we wanted to work with them because we knew most of the people come here and they have a huge Facebook following, over 250,000 people that follow their Instagram page. And so we're like, okay, this is a perfect, Gurdwara to work with. And so reached out to them with the help of Fraser Health, who were already doing amazing work with them. And I told them about the work that I wanted to do. And they basically told me, they're like, you know what, this whole floor is yours. and your youth are the future. We want you to take over and do whatever you need to do. And if you need support from us, please let us know. And so we literally, the first thing we went in there, I'm like, okay, this needs to be changed. This needs to be changed. This needs to be changed. We need to make sure everything is safe. And they were all on board with it. And of course, they had great suggestions as well on how to improve it as well. And so I think once we had the trust of, a huge foundation, we had the trust of Fraser Health, we had the trust of the Gurdwara, and them helping to promote our work. And I think even bigger than that was the trust of the people. When people came in and they saw the work that we were doing, they were amazed by it, that, these youth are spending their weekends instead of, doing anything else. I mean, you can't go out and party, of course. Instead of staying home or playing video games and all that, they were up here in the Gurdwara, they were educating the public. And so people were also spreading the trust as well. They were telling their friends and people about our messaging. And so I think at the end of the day, it really comes to the intervention that you have and the people that are there to help support it. And of course, like I mentioned before, the ethnic media really helped build the trust. We were on every single ethnic radio that was in Vancouver and the Lower Mainland. Even in Toronto, we were reached out by a lot of them. We were on TV, we were on mainstream TV as well. And I think all of them really helped establish the trust. And once people knew that the work that we were doing was, factual, they started sharing that information. And I think that's where we really overcame the misinformation that people were spreading. And of course, there's always going to be people there's still people who came in and they're like, you know what, we'll leave it to God. We're not going to wear a mask and we'll leave it to God. But now, luckily, masks are mandated. People have to wear a mask. But a lot of the times people have that opinion, and we can't change everyone's opinion. What we can do from our end is to really work and try to mitigate the challenges around COVID for the general population and the South Asian population specifically. There will always be people that think COVID is still a hoax after a year. We can't change that, but we can just try our best and work with all the stakeholders that are on board. We can't do all the work ourselves. I think that's one of the biggest takeaways from this is together we're a powerhouse. We're even bigger than any mainstream platform that's out there if we work together. And I think even what's happening right now in India with the farmers' protest, the power of social media has just shown that you can be bigger than any single mainstream media that is out there.
I think that's a really important message. And before I move on to the last question, I just want to let our participants and viewers know we've got about 12 minutes left. And please continue, if you have questions or comments, to put them in the chat and we'll weave them into our conversation. But something, Louise, I want to ask you, because something that Sukhmeet is talking about, you mentioned earlier, which is that coordination of effort. No one entity can make all of this work, and trust comes from, and sometimes having the right partner even. And the right partner in a lot of cases needs to be public health and government communication staff and policymakers. I know you've had some challenges, so I want you to speak a little bit to the idea of what advice do you have for public health and government comm staff, policymakers, to ensure that multilingual communities get the right information at the right time in a format that's most accessible and trusted for them. The Sukhmeet had a great experience with the Fraser Health authorities, but that isn't always the case in every community. So what are some potential pieces of advice that you would start with?
Another great question, Marco. First, Sukhmeet, I'm so blown away by all that you're doing and have done. And I think your point about we need to do it together is just the single most, I think, important point of this entire discussion. The vaccine bulletin that we're doing, there's no way that would be happening. It wasn't even our idea. It was doctors at Women's College Hospital who brought it to the Ontario Council of Agencies Serving Immigrants. And then a couple of other of us got involved, and the doctors bring the content expertise from the medical side. Okasi and Taibu Community Health Center in Scarborough bring the health/service provision/community voice, and we bring the content and distribution expertise. So nobody, as you said, and that's just to produce one piece of communication, so much effort. And even when we do this and we feel good about it, in the back of my mind is, why is it up to all of us? And how can we change this so that the sources of information do a better job? And I think The number one message is not that they should do it all themselves and cut out community. That is absolutely not what any of us would want to see. But the number one thing is to listen to community, and for government or public health communicators to sort of look at themselves and say, you know, one of the biggest things you learn in comms or marketing is audience. Segment your audience, and understand that that hasn't been done effectively or sufficiently in this sector. And secondly, once you segment that audience, you know who you need to reach, talk to them. Bring them into the design of your strategy, bring them into the implementation of your strategy. Do not go and talk to them, hear what they're saying, go away and develop your strategy and then implement it. That would be the worst case scenario. Second worst case scenario is go away, develop your strategy, come back and go, here, what do you think? Have them at the table, actually feeding in. Do little focus groups. You know, you're going to find so much rich information by talking to key people who can tell you, you know, the questions the community has, the channels that they want to use, et cetera. So it really is asking institutional communicators to rethink how they communicate. And finally, I would add, you are often going to need to resource that community participation. You pay people who participate in focus groups for their time. You pay representatives of service provision to spend 3 hours with you in a phone call providing strategic advice. That's a massive gap right now. You know, the work that we do at Refugee 613, not a single funder until the Info Hub came along was compensating us for sharing our expertise on this work. And so that's a mind shift that needs to happen. And I'm happy to say that we've had mixed results at different levels of government. Some folks we've advised listened really well at the beginning, think they now have it all under control and are off doing their own thing. And that's a little sad to see because there's still a lot more that we could contribute. But others are taking a longer term view and realizing that the lessons of the pandemic, like so many things, not just communication, hold true for beyond the pandemic. And so they are taking that time to listen and learn how to reach newcomer audiences. And I'll give a kudos to the Privy Council Office, IRCC, Public Health Agency of Canada. Their communicators are really starting to think about this in a more ambitious way, and starting to talk to community more, and we couldn't be happier.
Great, thank you, Louisa. George, any thoughts on advice for public health and government comms folks?
No, I would say continue doing what you're doing. Clearly, eyes have been opened. There is a greater awareness about the gaps in communications. I expect, just as the government seems to understand the need for supporting media, I think there is at least a nascent understanding that information needs of Canadians are changing. And I mean, my kids last weekend made fun of Doug Ford trying to speak different languages as part of his messaging on the pandemic. But from my point of view, every effort helps. If you try, and I think Sukhmeet would understand this, it's about leadership showing sensibility. Showing empathy. You don't have to pronounce the Punjabi word perfectly, but if you try and make an effort, I think that goes a long way. It's not just about standing in all these important cultural or ethnic spaces, you know, standing in front of the Golden Temple and taking a picture. It's about going more than that and making an effort and recognizing multiculturalism in a very true and granular sense. And I think that makes a world of difference. And I think people like Doug Ford, if they're getting it, I'm sure a lot more people are getting it too.
Thanks, George. You've all spoken really eloquently about making services accessible based on language, based on culture, and different ways of approaching information. There's a question, and I think you've talked to it in answering in terms of ask the group you're trying to serve how they want to be served. But there's a question about how you make your services accessible to the deaf community. And I'm wondering if that's something that's come up again. Sukhmeet, for example, you've got infographics that perhaps the visuals are helpful. Are there other things and other ways you've taken those kinds of in other communities into account in your communication?
Absolutely. I think one of the biggest things we have done is our infographics are very visual to the point that, you know, sometimes you don't even need the language next to it because you will understand exactly what is in there just by looking at it. And that's why we wanted to create that infographic as well, because for instance, like a lot of youth, for instance, they can't read Punjabi, but they can understand it if they hear it. But a lot of people might not even understand Punjabi if they hear it, but they can read it actually. And sometimes you can't read or write it either. And so for people who may not know that, or people who can't read Punjabi, can't write it, can't speak it, can't understand it, that's why we have those infographics where people can just visualize it. You don't need a health literacy at all, which is another thing is sometimes we put information out there that just goes way over the head and people just can't even comprehend it, which is why we just make the health literacy accessible to everyone, so that it doesn't matter if you can hear, if you can't hear, if you can speak a certain language, if you can't speak a certain language. These visual representations allow for you to understand it. And if you're visually impaired, for instance, then what we do with, for instance, when we do our outreach at the Gurdwara, we say all our things as well, and we illustrate it out to the public as well. So we really try to cater to every single population out there, and we try not to exclude everyone. Of course, I mean, it's always great to have people from different communities to come on board as well to help solve the issue. And I think, again, it just comes down to working together as a team. And if something's not going right, just highlighting what is going wrong and then improving on that so that in the future we can include that community that we might have missed.
So constantly keeping the lines of communication open, evolving, iterating, recognizing you're not going to get it right the first time necessarily, but committing to improving constantly sounds like the important underlying strategy there. And Louisa, along these lines, you've mentioned video, for example, as a communication tool, and we know that there are people in from some newcomer communities in Canada who are not even literate, who are not literate in their own language or in English, and so having a subtitled video is not going to reach folks like that. And there's an investment that needs to be made in supporting those communities. Can you speak a little bit to that kind of accessibility?
Sure. When we started at the beginning of the pandemic, we adapted, we were not focused on written material. We were focused on video for exactly that reason. But we didn't have the capacity to add subtitles for the hearing impaired. Later, we were able to do that with some videos. But the approach we took was, you know, videos can take a long time to produce. And we were turning them around in less than a week because we focused on just having presenters who speak the language, working from the same basic script and doing it in a conversational manner, the way we're speaking to each other now. And those were a big hit, especially with specific language groups for whom video is their first medium of choice, in particular the Arabic speaking communities across Canada. And so we've seen video be a really great tool. But again, it's still labor intensive just to get the script created, and I'm sure Sukhmeet has felt this intensely. And I feel for the institutional sources. I've kind of been pushing hard to adapt in this whole conversation, because often they're dealing with information that changes by the hour. So, you know, really feel for them when we're trying to create information that is evolving. You know, there's been a government announcement. Look at the most recent one in Ontario. No one really knew what was new about the last lockdown state of emergency in detail. It took a couple of days for that to come out. But what that means is that everybody's confused. And then even a few days after that is when we get around to giving translated resources to communities, if that. So that's where the equity piece really comes in. But I would say that it's so easy for communities to do this for themselves as well, if they can get their hands on a good summary or a good script that they know is verified or is trustworthy, and they can often just take what we've written or what somebody else has written, if they know it's a trusted authority, and make an audio file and ship that out over Telegram or WhatsApp, or do a phone video and put it up on YouTube. Those things are, often we have to think about what are the tactics that the misinformation folks are using. We should be using those too. And that's definitely one of them, just quick and dirty. We're trying to be professional, but at the same time, speed matters, and accessibility just in terms of the conversational aspect matters as well.
Thank you. We've unfortunately come to the end of our time. So I want to thank Louisa, George, and Sukhmeet, but I also want to leave everyone with 5 tips that I think kind of encapsulate what you've all been talking about, and come actually from the Newcomer Info Hub speaker series from Professor Nadia Kaidi from the University of Toronto, who's done a lot of work around information practices of newcomers. And the 5 are, and you've heard this throughout this theme, but ask newcomers what they need and where they get their information. Build relationships with people who newcomers go to for trusted information. Repeat the same messaging on multiple platforms and work with people who newcomers encounter on a regular basis. So for example, what Louisa was just saying about those different platforms, different modalities, different channels, as well as different physical locations like a Gurdwara. Go where newcomers already are. So Sukhmeet has nailed that, obviously. And then think of delivering information as community building. This isn't a one-way transaction, but this is relationship building with communities, and we need to be committed to that over the long term. So I want to thank all of you for participating and sharing your experiences, your knowledge, and your insight. This has been really interesting to me, and I hope it's been useful for everyone in the audience today.
Language rights matter beyond the 2 official languages of Canada. LAD 21 proudly supports the International Decade of Indigenous Languages. Thank you, panelists. We could not do this without you. See you in 2022. Find us on your favorite social media. Email us at languageadvocacyday@gmail.com or visit languageadvocacyday.ca.